there is a massive overhaul to the 2025 Medicare Part D plan cost sharing structure. It's going to be implemented January 1st. But before we dive into that, what you got to understand is one hard and fast rule on Part D drug plans is they change every year. Some plans change drastically, so don't fall asleep behind the wheel this week. Because if you have a Medicare Part D plan or a Medicare Advantage plan with a prescription included, you're going to get an annual notice of change, all right? And that might be the single most important document you get all year as far as your health care goes. Annual enrollment periods from October 15th to December 7th. That's when you can make your changes. You get your annual notice of change this week or next week. That's going to show you what are my premium changes? What are my deductible changes? What are my formulary changes? What are my tier changes? The lower the tier, the less expensive the drug. The higher up you go, the more expensive it is. So if you have original Medicare with a Medicare supplement and a standalone drug plan, or a drug plan bundled into your Medicare Advantage plan, the Inflation Reduction Act has effectuated 3 major changes that are going to affect you in 2025. I'm going to break down the changes you need to know about, how these changes are going to impact you in 2025, and what I think how this is going to play out in the future. There's winners and losers, and we'll go into that. So click subscribe below, share, hit like, share it with a friend that needs some education on this. Been doing this for 13 years. Guys, don't try to do it alone in 2025. Call your agent. If you don't have an agent, call somebody that all they do is Medicare like myself. Let us help you out. We've got assistants that have been working on folks' drug plans for a long time. So let's dive into it. So here are the 4 changes. I'm going to list them and then go into each one individually. First big change, $2,000 maximum out-of-pocket compared to the $8,000 true out-of-pocket in 2024. This is great news for folks that take expensive drugs or high-price tier 2 drugs as well. Second change isn't really the second change is minor. Your deductible goes from $545 up to $590. The third stage is no more donut hole, where you pay steep co-insurance for brand name drugs during the coverage gap. There used to be 4 stages of the drug plan. You moved into each stage in a convoluted way, and we're going to go into that very briefly, but you had your deductible. You had the initial copay co-insurance stage. Then you went into the donut hole. And then after you met a certain threshold, and the thresholds are different standards for different stages, you went into catastrophic. In 2024, you guys pay 0 for catastrophic. And the 4th stage is that CMS now has a payment plan for folks that can't afford to dish out $2,000 in January for one really expensive drug. They're going to spread that cost over 12 months. Okay, so before I dive into the impact of the elimination of the coverage gap or donut hole, the creation of the new $2,000 max out-of-pocket limit for you, the consumer, and the fact that Medicare has shifted the cost burden away from themselves and the drug manufacturer and have pushed that more onto the insurance carrier, your insurance plan, we have to be prepared for vast formulary changes, a big shift in drug tiers going from tier 2 to tier 3. And recently, Medicare did step in. Premiums were slated to go up 300% due to these changes in the cost burden on the insurance company and some price setting. So fortunately, Medicare came in. They're subsidizing the insurance companies so that those premiums don't go up 200%. They're going to go up minimally this year at 6%. And the insurance companies that have been subsidized have made they vow to keep the insurance premiums at a set level over the next few years. So that's great for you guys. So let's now compare the current Part D 2024 Medicare structure with 2025. So, okay, real quick, 2024, you got a $545 deductible. When you hit that deductible, you will pay the entire, let's say you're on Eliquis. Eliquis is $545 retail price. You're going to pay that $545 and you're going to move into the initial coverage. You have co-insurance and co-pays. And this is what makes donut holes so complicated. Initial coverage stage, once you hit the $5,030 threshold, what that means is the retail price of the drugs. You will add what you pay plus what the plan pays, and that whatever the total cost, retail cost of the drugs is, once the cost reaches 5,030, you fall in the coverage gap. Okay, so in 2024, once you hit the coverage gap, you will pay 25% of the cost of your drugs. The drug manufacturers will pay 75% of brand name drugs. Okay, guys, so once we hit the coverage gap, the dreaded donut hole, for 2024, the annual out-of-pocket costs for Part D drugs, if you reach the catastrophic phase, begins at $8,000. So $8,000 is what's called your true out-of-pocket cost. For most people, if you go straight from the deductible to the initial coverage gap through the donut hole into the catastrophic, about 1% of people in the United States will do that. For 2024, you're going to average $3,300 to $3,800 will be your max out of pocket. That's going to be your cap, all right, towards the $8,000. And then you pay zero in the catastrophic phase. I have had clients that have actually spent $8,000 in the donut hole because they took expensive generics and they didn't get that manufacturer's discount. All right, then we're in the donut hole. We pay zero. Very simple. Just remember, if you take expensive brand name drugs, your max out of pocket is between $3,300 and $3,800 this year. Okay, so let's explore the new 2025 Part D cost sharing model. So as you can see right there, there's only 3, not 4 cost sharing phases for your drug plan. You're still responsible 100% for that Part D Medicare deductible, which is $590 in 2005. But relax, guys. Like 2024, if you take generic drugs, you will not have to pay the retail price of those during the deductible phase. Rather, you're probably going to have a low copay for generics, but brand name drugs like Eliquis or Humira, they're going to catapult you right on day one in January from the deductible phase right into the initial coverage stage where you're going to pay 25% for all your drugs. Once your out-of-pocket costs hit $2,000, you fall into the catastrophic phase. You never pay a dime again for the rest of the year because the insurance company, Medicare, and the drug companies must pay all costs in the catastrophic phase, in that phase. So, for example, let's use a popular arthritis drug, Humira. Humira, the retail price is $7,000 per month. So in January, when you go to fill your Humira, you're going to pay the $590 during the deductible stage, and that same day you're going to fly right into the initial coverage stage. So the drug costs $7,000. You paid $590 during the deductible phase, so you're still on the hook for the remaining $6,410. Just you're subtracting $7,000, which is the retail price, from what you already paid in the deductible, which is $590. That gets you the $6,410. But you only have to pay 25% of the cost of drugs in the initial coverage stage. So 25% of the remaining cost of Humira is going to be $1,602 because basically, so you're responsible for 25% of the retail price of the drugs during the initial coverage stage. You still got to pay 25% of $6,410. So what is 25% of that? $1,602. That's your cost sharing responsibility in the initial coverage gap, the second stage. Deductible, you paid $590. You flew right into the initial coverage stage. You paid $1,602. So remember, you stopped paying for all drugs at $2,000. So you also went from the initial coverage stage right into the catastrophic phase. You spent $590 during the deductible, and your coinsurance, you had to pay $1,602 coinsurance during the initial stage. So if you add those two up, $590 plus the $1,602 in the initial coverage stage, you've hit the coverage gap. The catastrophic stage. You're at $2,192. So subtract $2,192 from your max out of pocket, which is $2,000. So $192 is going to be in the catastrophic phase. You don't pay for it. That $192 falls into the third and last stage, known as the catastrophic stage, where you pay nothing for the rest of the year, but the insurance company must pay 60% of all your medications. Drug company pays 20%, Medicare pays 20%. That is amazing for folks on expensive brand name drugs. But what about the rest of us? So it's important for us to understand who pays for what with this new 2025 drug plan structure, because that's going to determine the changes in premiums, tier changes, formulary, the use of step therapy when we know you don't need this drug, you need the generic version of this. So that all these come into play because in 2024, if you look at this chart, where things got really pricey, if you look in the donut hole, the coverage gap, where you pay 25%, drug manufacturers paid 70% of brand name drugs. In the donut hole, that your plan paid 5%. Catastrophic coverage, Medicare paid 80% of all those expensive brand name drugs. In the catastrophic phase, your plan paid 80%. Now, 2025, different story. Your insurance company's on the hook for 65% of all costs during the initial coverage stage. And on that last stage, which a lot more people are going to hit the catastrophic coverage, the max out of pocket's only $2,000. It's a true max out of pocket, meaning it's what comes out of your pocket, what you pay. And you're going to have a ton more people that are going to fall in the catastrophic phase. The insurance plan is on the hook for 60%. So how is that going to impact premiums, formulary, tier change, step therapy? As a result of the Inflation Reduction Act, we already know massive changes to the Part D drug plan structure. No more donut hole, $2,000 max out of pocket, and the cost burden shifted from Medicare and the drug manufacturers to the insurance company. So you have to ask yourself, is the insurance company just going to be philanthropic? Humana, United Healthcare, CVS, are they just going to say, we don't care about our stockholders. We're just going to eat all the costs that the government has put upon us, and we'll just, we'll be good. We'll lower the CEO's salary a little bit to make room for our clients. No, all these moving parts are going to be affected by these new changes. We're going to look at the effect on premiums, the changes in the formulary. Be ready for those. Tier changes, the single most important thing I'm going to talk about, and why drug companies are going to use step therapy and prior authorizations to lower their cost share, to help their bottom line, to help their stockholders. What did they do with premiums? So a couple months ago, due to these changes in the Inflation Reduction Act, the max out of pocket of $2,000, no more donut hole, the Part D, the insurance companies submitted their Part D premium changes, their annual notice of change that's going to be sent to you guys probably this week or next week, at the latest by September 30th. And here's what here's what the insurance plans did. Part D prescription drug plans were submitted to 2020 to CMS. That included nearly a 300% increase in Part D premiums. The average Part D premium gross bid was $64.28 a month in 2024. Get this, for 2025, the average monthly premium bid is $179.45. Now, I refer to those numbers as gross bid because a portion of that's being subsidized by the taxpayer instead of the consumer. So this was done behind the scenes just a couple weeks ago in an attempt to mitigate the cost of the increased premium. CMS has announced a voluntary 3-year program. And what it's going to do, it's going to limit premium increases by creating new subsidies to the insurance companies that would apply a uniform reduction of $15 to the base premium for all plans. So basically, the Inflation Protection Act had unwanted repercussions. So they came in, they gave the insurance companies wrote them a check for about $10 billion. They're going to use that money. Hey, this is good for you. I mean, we're already, $25 trillion in debt? What's another $10 billion? Joking, but seriously, what this is going to do is going to limit year-over-year total premium increases to no more than $35 per month. So that's the most they can go up on a monthly premium is $35. Okay, in conclusion, relax. The base premium for 2025 is $36.78. It's an increase of about $2.08 or 6% over the base premium. Although the 6% cap doesn't apply to the individual premiums that plans can change, it does help to limit premium increases. Now, how are these changes going to impact your formulary and your tier? So a formulary is the list of all your drugs a plan covers. Now, keep in mind, a plan does not have to cover every single drug out there. All right. If it's not on the formulary, you're going to pay 100% of the retail price. Each company has their own list of drugs or their own formulary. All right. And all the drugs are sorted by tiers. Depending on what tier your drug is in, that determines how much you pay. The lower the tier, the cheaper the drug. So there's pressure on formularies because the 2024 benefit structure incentivized drug plans to adopt benefit designs and formularies favoring the higher cost brand names. They got higher rebates from the manufacturers, and Medicare paid 80% of the cost of these expensive drugs in the catastrophic phase. The drug manufacturers paid most of those expensive drugs in the donut hole. So they were incentivized to push the very expensive brand name drugs because they were off the hook when you got into the donut hole and the coverage back. Now, 2025, a little bit different. The redesigned Part D benefit provides a little reason for drug companies to push beneficiaries beyond the initial coverage phase. Because remember, unlike 2024, where Medicare pays 80% of those expensive brand name drugs in the catastrophic phase, the plan has to pay, I believe it's 65% of the cost of the drugs in 2025. So what are they going to do? How are they going to make their money? They're going to change their formulary. So they're incentivized in 2025 to change the formularies by putting certain drugs on the tier 4, the non-preferred formulary tiers, or they might remove a drug altogether. I can guarantee you're going to see a lot of step therapy. Oh, you don't need this drug. We want you to try this generic first to make sure that is more cost effective for us rather than the brand name. So you're going to see a moderate demand for growth for certain drugs. And I'm going to get to some examples of some drugs, but just remember, generic drugs placed on higher formulary tiers have higher cost requirements. Typically, a tier 4, what we like to call a non-preferred formulary. They could be generics on tier 4s. All right, good example is the generic for Lyrica. I believe it's Pregbalin. That is a drug that's got a $183 retail price. So are they going to put that Pregbalin on a tier 1 or tier 2? No, $0 to $10. Or they're going to put it on a tier 4. Typically, tier 4s are like 40 to 50% of the retail cost. So you're going to see drugs like Pregbalin that are replacing Lyrica instead of the generic tier 1 or tier 2. They're going to shove that on a tier 4. You're going to pay 40 to 50% of the retail price of the drug. So plans can altogether remove a drug. When there's a generic alternative, they can just get rid of that brand name and they can put the generic on there. And chances are it's not going to be a tier 1 or 2. It's going to be a tier 4 where you're paying 40% of the retail price of the drug. Not all generics are cheap. And I got news for you guys. 50%, 57% of generic drugs in 2022 were not part of the generic tier 1 or tier 2 tiers. Let that sink in. 57% of all generic drugs are not part of the generic tiers, the tier 1 and tier 2. Guys, GoodRx, single care. That's your solution. Most of my clients get their Eliquis, their Symbicort, their Xarelto, their brand names through Canada. Pennies on the dollar. If your agent hasn't really talked to you about alternative ways to get your drugs and just sells you a drug plan and says, good luck with that one, might be time to find a new agent. So I will email you the Canadian pharmacies that I use that are accredited Canadian pharmacies endorsed by ARP, the New York Times. Good example, Eliquis. Eliquis is a $545 retail price of the drug. I'm amazed at the number of people that I've seen that go into a plan that has Eliquis where they have to pay 25 or 40% of the retail price. There's drug plans out there where you can get Eliquis for $47 for a 1-month supply until you hit the donut hole. But guess what? No more donut hole next year, all right? Okay, guys, so I'm going to wrap up the tiers and the formularies. You guys get the picture, but understand Here's a good example. If I'm the CEO of the company and I'm looking at this drug list, gabapentin, it's $38 retail price. Over the years, it's been a tier 2 to tier 3. It's $10. So I'm going to set up my tier 3. If I'm a CEO, that's a $45 brand name copay. So I'm going to bump that up to a $45. So gabapentin, I'll make that a tier 3. Instead of paying 10, you'll pay 45. Pregabalin, it's the generic for Lyrica. It's got a retail price of $183. So rather than list that baby as a tier 1 or 2, or even a tier 3, 183, I'm going to put that as a tier 4, which is a non-preferred drug. So you pay 50% of the retail cost. You end up paying about $91. Eliquis, if you have Eliquis, you want to try to find a formulary where the tier is a tier 3 brand name. So you're paying probably $20, $25. You're going to be paying $50, $55 copay. I like that a lot better than, let's say, a tier 4, which is 50% of the retail price of the drug. You get the picture. Eliquis, yeah. So you want Eliquis to be a copay, not a coinsurance. Or you can go through Canada. My clients get Eliquis for $82 for a 3-month supply. That's taking 2 pills a day. The generic for Celebrex, that is a generic drug. GoodRx, you can get it for $17. Can almost guarantee you that sucker's going to be a tier 4 non-preferred drug. And this is an example. These prices can change, but typically tier 4, you're going to pay a percentage. 50% of the $353, you'll pay $176 a month. So, guys, be careful. And the Medicare.gov site is convoluted and complex, quite frankly. Most of the clients that I talk to that use it, we have our own proprietary drug finder software that's a whole lot user-friendly. I'm going to get that on my MayRiverMedicare.com website next week. Drug plans aren't out yet, but I'll get that up there so you guys can use my tool. All right, so in 2025, expect these Part D plans to place more generic drugs on higher tiers. You're going to be looking at a lot of tier 3, tier 4 generics, even tier 5. Guys, another thing about tiers, in 2024, only 15% of generic drugs were placed on a tier 1 with a 0 copay. Only 15%. And while the percentage of products on tier 2 generics has increased, I believe, from 21% to 36% over since 2017. The most appalling part of this whole thing is there's been a huge spike in the placement of generics on tier 3. Tier 3 typically $50 copay, and it's going to get worse, all right? So the gabapentin a couple years back was $10, and next year it was $45, all right? So just be careful. Talk to an agent like myself that can help you. Don't get all excited about a new generic that's going to replace your brand name, because patients are often denied access to these new generics. On average, newly approved generics launched in 2020 are covered only by 21% of the Medicare plans. When first generics are covered, they were placed on non-generic tiers 70% of the time. Guys, go Canada, go Mark Cuban, go GoodRx, Single Care. Do your research. Find an agent that has assistance. So many of my clients have what's called extra help for prescription drugs. Their generics are 0 to very cheap, and expensive brand name drugs like Humira would cost them $12. I'll have to double check the statistics for 2024, but somewhere around $12 and change. That's what they would pay if you have extra help. So if you make less than $19.03 a month, you might want to look into applying for extra help, or just have your agent do it. We do that for our clients. So January 1st, it's during the bowl games. You need your Humira. You got your new drug card. You go to CVS. Yes, Mrs. Jones, that'll be $7,000. Well, oh, wait, I've got a Part D standalone drug plan. You hand it to the pharmacist, and right off the bat, you better be prepared. You've got a $590 deductible, which you'll spend. You're going to go crash right through into the initial coverage stage where you pay 25%. The plan pays 75%. So I just had the calculator out here. So You've already spent $590, so you want to subtract your deductible from the price of the drugs, all right? And that's $6,410. And then you know you're responsible for 25% of the $6,410. All right. So if you take 25% of the 6,410, you come out with 1,602. So that's the 25% you owe. But wait. If you add your deductible that you paid while you're waiting in line, and you paid the 1,602, you've gone through the coverage gap. You're done paying for drugs for the rest of the year. You hit the 2,000 mark, okay? You actually spent 2,192. So that $192, you don't have to worry about that. The insurance companies and Medicare and the drug manufacturers pick all that up for you, and you're done paying. So what we're going to do is we're going to spread out the 2,000 you owe over 12 months. So rather than have to fork it all over and not be able to afford your drug and get sick, Medicare is going to allow you to spend $166. It's a payment plan. It's basically like you're buying a car, and that's your monthly car payment to keep that engine going and keep yourself going and feeling good. All right, so that's the payment plan. So take your time in 2025 and look out for your annual notice of change, which should be in the mailbox by September 30th, probably this week. Make sure your drugs are on your 2025 formulary. See if a drug is shifted from one tier to another, a tier 1 to a tier 3. Higher tier, higher cost. And either go to Medicare.gov Plan Finder or go to www.mayrivermedicare.com. September 20th, we're going to have our user-friendly. You can shop out drug plans, enroll in it. It's just a lot easier. I've had issues with Plan Finder, all right? People get confused and frustrated. So you're just going to type in your drugs, you type in your pharmacy, search and enroll yourself or with our assistants, but we'll help you year-round if you use our quote enrollment tool. September 25th, that'll be up. Overall, I'm happy with the $2,000 max out of pocket. It's going to help a lot of you guys over the long haul. And I'm not concerned about these expensive brand name drugs. I use about 6 different other avenues to get my clients drugs when the drug plan fails them. Remember, it's a formulary with a select group of drugs on it. The drug's not on the formulary, you got to pay 100%. And the drugs that are on the formulary typically are overpriced. They go up to tier 3 or 4 when they should be a tier 1. So we got multiple avenues to find effective drug costs. GoodRx, Single Care, Amazon, the Mark Cuban website's great. I've used Walmart, Kroger, the Walgreens program, whatever we got to do, okay? One of my agents that works underneath me, she found an incredible resource that she shares with me for getting prescription drugs. But I mean, I go through Canada for drugs like Eliquis, Januvia, Zetia, Xarelto. Just as example, you can get 3 months of Eliquis for $80. Symbicort is a $320 brand name asthma spray. I order that for my own use. It's about $30 a month. Same exact drugs made by the same pharmaceutical company, but it's coming in through Canada. All right, and we got to do what we got to do to we're on fixed incomes. So you definitely want to look at your Medicare supplement each and every year, usually around your policy anniversary date, but now it's good too. And you want to make sure if you've got the Plan G, you might want to seriously consider the Plan N as in Nancy. Virtually the same coverage, a few little co-pays for doctor and emergency room, but overall you're going to get more value. And the Plan G is going up 12, sometimes 15% in some states a year. My Plan N clients are loving life. We average about 3% a year overall. So if you have any questions about your drug plan, your supplement, email us at chrisdewey@mayrivermedicare.org. Go to mayrivermedicare.com. Fill out a form. Mostly it's just we will give you actual quotes for the supplements. That's our niche. So get a quote just for the heck of it. And then the message is just put, I want information on the Canadian drugs. We'll shoot that out to you, okay? We're a Medicare, Obamacare, ACA niche company. That's all we do. Dental vision, some indemnity plans, but Obamacare, Medicare, we educate, we empower, we enroll, and we'll put you in the right plan. This is Chris Dewey with May River Medicare. Have a great day. Bye-bye.